Hello, everyone. Can everyone hear me? Say hi if you can hear me. You can feel free to post in the chat box there. I'm Joan. For those who haven't met me before, I'm from Ashcroft Medical English, and I'm here today to help you prepare for OET speaking. Just to give a little bit of background information about me, I'm a former UK doctor, information provider, a premium of OET preparation provider. And I'm just delighted to be here as part of the All Stars team. Oh, that's great. I can see some hellos coming in. Wonderful. So we've got a nurse from the Philippines. Fantastic. Lovely to meet you. And I can see we have a viewer here from Pakistan. Wonderful. Lovely to have you here. So, as I'm waiting for you to all say hello and introduce yourself, it would be great also if you could let me know your profession. Yes, the profession as well would be great. And has anyone got a test coming up really soon? Let me know in the comments. Let me know in the chat box. It'd be great to hear. So anyway, today's session is going to be all about OET speaking, as I've said, and the session is going to be focused in on something called signposting. Some of you will be familiar with it, some perhaps not, but I'm hoping by the end of the session, all will become crystal clear. Okay, so I think we should get started. We've got quite a lot to get through. If you've got questions at all, they will be covered at the end of the session. There'll be a question and answer session, and I'll do my best to answer as many questions as possible. And any that I don't get to, please feel free to send me an email. You'll get my contact details at the end of the session. So, okay, let's get started. Just going to share my screen with you just now. Okay, so as I've said, today's session's about how to signpost successfully for top scores. And who doesn't want a really good score in OET speaking? So with what I'm going to share with you today, you'll be able to find out how you can boost your score for a specific part of the assessment criteria in OET speaking. As I've said, I'm Joan Ashcroft from Ashcroft Medical English. I'm a former UK doctor and here to just help you do the best that you can with OET speaking today. So in today's session, what will we cover? We're going to have a look at what signposting is. We're going to see why signposting is so important, not just for OET, but for real life communication with your patients. How to signpost successfully on test day. And as I've mentioned, there'll be a chance at the end for a bit of a questions and answer session. By the end of the session, you'll understand what signposting is. You'll know how to use it successfully to increase your score. And what I'm going to give you are some clear examples of exactly what you can say when signposting. Before I forget, I will be offering a free guide. This guide will include 10 top tips to pass OET speaking first time. So don't miss out on that. You'll get the details at the end of the session. So going back to the session topic, what is signposting? So let's break it down into its component parts. Okay, a signpost, what's that? So the noun, a signpost, means a pole with a sign on it, especially showing the way to a place or the name of a road. And if we think about a signpost as a noun, we know what that is now, but what does it mean as a verb? So signpost as a verb, so to signpost means to show the direction of something on a signpost. So, what has this all got to do with patient consultations? Let's make it a bit more clear. So, let's imagine you're in a patient consultation. You are there as the guide for the consultation, leading the way through it. What happens if you don't signpost during the conversation? Does anyone have any ideas what might go wrong? If anyone has any suggestions, you can put them in the chat box. I'll give you a moment to think about that. Okay. So now you've had a chance to think about that. Let's see if your thoughts are similar to my thoughts. Okay. They're going to be thinking to themselves, where is this conversation going? They're going to start to feel a bit lost and they're going to get confused. Not a great outcome for clear patient communication. So let's move on to just clear up exactly why signposting is so important. So basically, it adds much needed structure to the consultation. Without structure, things get a bit confusing. As we've mentioned, it makes it easy for the patient to follow the conversation. They won't end up getting lost. And the bonus is it actually makes things easier for you too. Your own thoughts will be more organized and it will make the whole process of going through the role play a lot more logical. As a result of all of this, we get effective communication, great for real life consultations. And of course, you're going to get a higher score for OET speaking because of it. So let's dive deeper into exactly how signposting improves your score. To understand this, we need to kind of be aware of the OET speaking assessment criteria. So some of you will already know about this and will already be very clear on what the assessors are looking for exactly when it comes to assessing your performance in OET speaking. In simple terms, it's divided into looking at your linguistic skills, so the linguistic criteria, and looking at your clinical communication skills. So, the way in which you interact with your patient during the consultation. And both components are really important. But today, we're looking at signposting, which relates to the clinical communication criteria. Now, the information on the assessment criteria is all available on the official OET website. So, if you haven't looked at this yet, I urge you to do so. And this is the second page of the assessment criteria, the first one being the linguistic criteria. So, we're on page 2 of the criteria here, the clinical communication criteria. And we can see that we've got 5 sections here, which all relate to different communication skills that the assessors are looking for. So today we're focusing in on this group here, C1 through to 3 is shown in the box here. We're specifically looking at C2, signposting, changes in topic. So as I've said, if you're not familiar with the criteria yet, please go to the official OET website and I've got a link here, but you might want to just go directly into the OET website to find these criteria and try and understand them. Okay, so let's look at when you should signpost. So in the role play itself, you will be signposting at different points. So to keep it simple, we can think of signposting at the beginning to indicate the first topic of conversation in information giving. We can signpost in the middle to indicate topic changes, and we can signpost at the end to summarize the information that has been given. So now we know when to signpost, let's look at how exactly to signpost. So to do this, we can think of it in two simple steps. The first step being to use appropriate signposting language. So these are words and phrases that let the listener know that you're about to change the topic. And of course, you need to know what the topic of conversation is. So these are some examples of signposting language here. So we might say, first of all, and then continue on to the topic. Or we might say, let's talk about, and continue. And if we're towards the end of information giving, we might say, to sum up, and then give our summary. So of course, the other component of putting this all together is to know the topic you're going to talk about. So let's have a look at the beginning of information giving. So here we can see that we're using the signposting phrase first or first of all. So imagine you're in a consultation and your patient has come to see you because they've been having problems with headaches. You've taken their history, perhaps examined them, and then you want to give some information. So you might say, first, I'd like to explain the likely cause of your headaches. Okay, so we've used signposting language here. And what's the topic? Would anyone like to tell me what they think the topic of conversation is here? So you'll get your information right there. I'll give you a moment to think about that. So not too tricky, this question. So hopefully you haven't found that too hard, but let's see. So the topic is the cause of headaches, i.e. the diagnosis, such as migraines, for example. So you might make a diagnosis of migraines and share that information with your patient. So moving on then. Let's have a look at topic changes. So imagine that we're in the same consultation, that you've explained what you think the diagnosis is, and you want to move on to the next topic of conversation. So we can see that topic 1 has been the diagnosis. But what's topic 2? Let's take a look. So you might say, for example, now that we've discussed what's likely to be causing your headache, let's move on to what can be done to help you. So topic 2 is, you can put your answers in the comments if you've got an idea about this. I'll just give you a moment. Okay, let's see if your thoughts are the same as mine. Okay, so topic 2 is all about treatment of the headache. So topic 1 has been the diagnosis, topic 2 has been treatment. I see an answer there as assess. Okay, so yes, it wouldn't be assess, but you're thinking in the right way. You're thinking of the next action, but in fact, yeah, we're talking about treatment options there. But good work, good try. Okay, now moving on to summarizing. So signposting language we could use here. For example, we might say to sum up or in a nutshell. Okay, so this is going to indicate that we're going to give a summary. We might say, for example, to sum up, Your headaches sound very typical of migraines, and you should see improvements with the lifestyle changes I've advised and the medications I've prescribed. But if things don't improve, please come back to see me. Okay, so we've got the diagnosis here, we've got the treatments mentioned here, but what's the third topic? Anyone got any ideas how we would summarize this last section here? Okay, so we're thinking, if things don't improve, please come back to see me. So what is this part of information giving? What's the topic? Let's see if your ideas are the same as mine here. So we could summarize the last topic as the next steps to take or the follow-up plan, something like that. Okay, so now we've covered the beginning of the consultation, topic changes, and summarizing in terms of signposting. So now we're going to try and put this all together, okay, with an actual sample role play. We're going to start at the beginning, and we're going to start with information giving at the beginning of the process. So here you can see a sample role play card. And in the role play card here, you're a doctor. So I know not everyone is a doctor here today. But you'll still get the idea from this example. So let's have a look. You're in a local medical clinic and you're a doctor. You see a 45-year-old patient who has suffered from a mild anterior acute myocardial infarction 2 weeks ago. Recovery was uncomplicated and the patient was discharged from hospital 4 days ago. He or she is now concerned about how much physical activity is appropriate during recovery. So you can see that the first bullet point here is finding out the reason for the visit. So this is information gathering. So this isn't what we're focusing on today. We're focusing on information giving. And the information giving process starts here. Okay, so let's have a closer look at that. You need to reassure the patient about fatigue. You're going to remind the patient about heart attack recovery. Then you're going to go on to emphasize the importance of exercise. Okay, so let's break that down a little. So in the information gathering part of your consultation, you've found out the reason for their visit and they're concerned about their symptoms and the exercise that they can do now. The topic here. So how can we summarize this? Because we've got quite a lot of information here. We might want to summarize it to keep things simple. We're talking about the symptoms after a heart attack. You're going to remind them about heart attack recovery, and you're also going to emphasize the importance of exercise after a heart attack. So how could we summarize this information? Does anyone have any ideas? I'll give you a little moment to put any ideas on how we would summarize this bullet point. What is it about? Okay, let's see what you've got compared to what I have here. So we can have a look at these main components of this bullet point and think of them as the recovery process. So this is all about the recovery process after a heart attack. So we can summarize it in this way. So how does it all come together then? So this is how we would put it together. We know our signposting language, we know the topic, and we simply add them together. So we might say, first, let's talk about the recovery process. An alternative, if you didn't come up with the recovery process as a way of summarizing, you can do it slightly differently. Okay, for example, you might say, first, let's talk about how tired you've been feeling. Then we'll talk about the recovery process and how exercise plays a role in it. So, as you can see, there's flexibility in this. The main point is to signpost the conversation and just make the topic clear. So now we're going to move on to the middle section of a consultation where you'll be signposting topic changes. Okay, so we can have a look at this here. And what I've done, just for speed, since we've got limited time in today's session, is I've summarized these bullet points here. So I've summarized them into the recovery process, suitable exercise, returning to work, and prevention. Okay. So moving on to the next slide, I just want to demonstrate this idea of signposting the topic changes. So let's have a look. So for example, we're going from the recovery process to talking about recommended exercise. So if we have a look at what's said on your role play card here, it says, give recommendations for exercise. It gives you some details there. Then it says, advise on importance of joining cardiac rehabilitation program. So you're going to be basically giving recommendations for exercise after having a heart attack, which leads to the summary here that I've given. So here we might use signposting language such as now that we've, and then let's. Then in the gaps, we're going to be mentioning the topics, the recovery process, and recommended exercise. So what could we say? This is an example. We might say, now that we've talked about the recovery process, let's discuss the type of exercise that's recommended at this stage. So we've simply signposted going from topic 1 to topic 2. Moving on then, on to the summary. So this is when you've come to the end of the consultation and you might want to summarize the information that you've given. Sometimes you don't have time for this, but ideally you will. And if you do, signposting that you're doing the summary is excellent. So here, what we're going to do is simply use the appropriate signposting language and add together all of the different topics that we have here. So as you can see, it's going to be important as you look through the role play card to summarize the topic that's in each part of the task. Okay. So we're going to use appropriate signposting language. In this case, for a summary, it might be in a nutshell or to sum up, for example. And then we're going to mention the topics covered throughout the consultation. The recovery process, suitable exercise, returning to work, and the prevention of future heart attacks. So putting it all together then, this is just one example of how you might summarize. You might say, okay, so to sum up what we've discussed today, I need to read it properly, right? Okay, so to sum up, what we've discussed today is what to expect during the recovery process, the right type of exercise that will help you recover, returning to work in 4 to 6 weeks if you feel ready, and simple lifestyle changes that will help reduce the risk of any future heart attacks. Then at the end, we might add, have we covered everything you wanted to ask today? Okay, so hopefully that gives you an idea of how you can use signposting at the start, the middle, and the end of the consultation. So we've learnt today what signposting is. So it's a way of indicating a change in topic. We've learnt how to signpost. So we're going to use signposting language plus the topic or the topics. We're going to, we've looked at when to signpost, which is at the beginning, the middle, and at the end of information giving. And we've also clarified why it's actually so important. Okay, so it's important for clear communication in real life consultations, and it's also important to help you increase your score in OET speaking. So, if there are any questions, we've got a few minutes left, and we can cover anything that's come up. Okay. Okay. So I'm just going to have a look at what comments have, what questions have been posted there. If you just give me one moment as I go through those. Okay. So bear with me just now. Let's have a look. Okay. So just trying to see where we've got them there. Okay. Just scrolling through. I see some wonderful answers that you've given me throughout the consultation. So that's perfect. There's a comment from Anish about repetition. So I'm not 100% sure on the question, but I think the question is repetition of what you're saying a problem? So in actual fact, it kind of helps to have not repetition, but just clarification, a summary of the main points that have been given. Ah, right. I see. I see. You've clarified your question. Thank you so much. So you said, in the summary, can you repeat? So you're not exactly repeating. So I wouldn't advise you to literally repeat what you're saying. What I would encourage you to do is is really more summarize, paraphrase. So I wouldn't repeat the exact same words. It's about leaving the patient with a clear idea of what's been spoken about. So you're not going to repeat everything you've said before. This should be avoided. You just want to be very concise and hit the main points that you want your patient to go home with. I hope that helps answer the question. Moving forward, so I can see a question. Can we use moving forward to signpost? Um, um, so you could say moving on. Um, I would be careful just to make sure the tone is nice and polite the whole way through. But yeah, you could use moving on, perhaps moving forward. Would not be quite what we're looking for when we're trying to suggest that we're going from one topic to the next. It could be used, for example, for talking about plans in the future. I see another very, very good question, a very common question, and this will need to be the final question for the session, I'm afraid, due to lack of time. So the question is a summary compulsory for all role plays? So the summary serves as a really good opportunity to signpost and to also organize the information given. So the summary that I've mentioned at the end of the role play isn't in itself compulsory, but it does allow you to demonstrate a lot of skills that will help your score. A summary nearer the beginning of the consultation is really useful. That does come into the communication criteria, where you're going to gather information, from your patient and then summarize what you've gathered to make sure that you're both on the same page. I hope that helps answer the question. Okay, so I want to just make sure that you do get your link. I need you to get your link, don't I? For your free PDF. So don't forget to go and grab your free PDF, okay? Here's the link so that you can get it, ashcroftmedicalenglish.com/OET hyphen speaking. I'll pop it in the comments too for you. So please don't miss out on that. And thank you so much for all being here. See you next time. I'll be back on June the 5th for a session on OET writing, how to choose the right content for top scores. So thank you so much for being here. If you want to get in touch, here's my contact information. It would be wonderful to hear from you. Take care and see you next time.